1. Which principle of adult learning is most applicable when teaching EEG interpretation to experienced clinicians? A. Repetition of basic content. B. Relevance to real-world application. C. Memorization of textbook definitions. D. Passive lecture-based delivery. 2. In EEG training, formative evaluation is best described as ... A. Assessing final performance at the end of training. B. Providing ongoing feedback during learning. C. Certifying competency through licensing. D. Comparing learners' results to national averages. 3. When developing a curriculum for EEG technologists, which step ensures alignment with professional standards? A. Listing personal teaching preferences. B. Reviewing regulatory body guidelines. C. Reducing assessments to save time. D. Using outdated educational materials. 4. A senior technologist mentoring a new trainee on EEG artifact recognition demonstrates A. Summative assessment. B. Experiential learning. C. Abstract curriculum design. D. Independent study. 5. Which communication technique improves collaboration during EEG team debriefings? A. Using complex technical jargon exclusively. B. Encouraging open dialogue with structured turn-taking. C. Limiting discussion to the senior staff. D. Avoiding feedback to reduce conflict. 6. In EEG education, which evaluation method best measures applied skills? A. Multiple choice theory exam. B. Simulation-based practical assessment. C. Written reflective essay. D. Attendance tracking. 7. When designing EEG training, Bloom's taxonomy is primarily used to ... A. Provide regulatory accreditation. B. Guide progressive learning objectives. C. Replace clinical practice. D. Eliminate peer mentoring. 8. During adult learning in EEG courses, self-directed study is most effective when A. Learners have autonomy with structured support. B. All decisions are made by instructors. C. Study materials are generic and irrelevant. D. Feedback is withheld until final testing. 9. An EEG educator ensures compliance with HIPAA by A. Using anonymized case studies in teaching. B. Sharing patient data for research without consent. C. Allowing free access to raw patient recordings. D. Uploading identifiable EEGs to social media. 10. When evaluating mentoring success in EEG practice, the most reliable indicator is A. Mentor's years of experience. B. Mentees' demonstrated improvement in competency. C. Number of hours spent mentoring. D. Availability of printed resources. 11. Which adult learning principle supports using case studies in EEG education? A. Rote memorization. B. Problem-centered approach. C. Passive observation. D. Authority-based teaching. 12. Summative evaluation in EEG education is best represented by ... A. Daily feedback on practice tasks. B. Final certification examination. C. Informal group discussion. D. Peer observation notes. 13. Which mentoring strategy fosters long-term EEG competency? A. Encouraging critical thinking and independence. B. Dictating every action without explanation. C. Restricting access to resources. D. Minimizing real patient exposure. 14. A key step in curriculum development for EEG safety training is A. Identifying learning outcomes. B. Eliminating objectives to save time. C. Ignoring national standards. D. Skipping needs assessment. 15. During EEG teaching, how can educators respect adult learners' prior knowledge? A. Discouraging learners from sharing experiences. B. Incorporating learners' past clinical encounters into discussions. C. Repeating basic definitions only. D. Limiting examples to textbook cases. 16. Which evaluation tool provides the most objective measure of EEG skills? A. Peer impressions. B. Structured performance checklist. C. Instructor's general opinion. D. Self-reported confidence. 17. When mentoring EEG trainees, scaffolding involves A. Gradually reducing support as competence grows. B. Withholding guidance until learners fail. C. Providing identical tasks regardless of level. D. Avoiding progressive challenges. 18. Regulatory compliance in EEG documentation requires A. Accurate, timely, and secure reporting. B. Sharing data informally for learning. C. Using personal devices for patient files. D. Disregarding confidentiality agreements. 19. The principle of experiential learning in EEG education is applied when A. Students analyze real EEG case studies. B. Learners memorize electrode positions without context. C. Educators avoid hands-on practice. D. Training excludes practical exposure. 20. In curriculum evaluations, stakeholder feedback is essential for A. Ensuring continuous program improvement. B. Reducing learner participation. C. Avoiding changes to established content. D. Ignoring new industry requirements. 21. Which adult learning principle is reinforced when EEG training uses problem-solving scenarios? A. Self-directed learning. B. Passive note-taking. C. Memorization of isolated facts. D. Instructor-centered teaching. 22. A preceptor assessing a trainee's ability to troubleshoot EEG equipment is performing A. Norm-referenced evaluation. B. Criterion-referenced evaluation. C. Summative-only assessment. D. Self-reflective grading. 23. Which mentoring approach improves communication confidence in EEG trainees? A. Encouraging active questioning. B. Discouraging open dialogue. C. Ignoring nonverbal feedback. D. Limiting communication practice. 24. In EEG curriculum design, alignment with national credentialing exams ensures A. Learner skills match required competencies. B. Instruction ignores professional benchmarks. C. Programs reduce learning rigor. D. Courses remain unstructured. 25. Which feedback strategy is most effective for adult EEG learners? A. Immediate, specific, and constructive feedback. B. Annual generic performance reviews. C. Delayed feedback after several months. D. Minimal corrective comments. 26. A training program that integrates ethics in EEG education primarily supports ... A. Regulatory compliance and professional accountability. B. Memorization of technical steps only. C. Avoidance of discussion on confidentiality. D. Exclusion of patient-centered care. 27. Peer mentoring in EEG practice is most beneficial when A. Both parties engage in mutual learning. B. Information flows only from expert to novice. C. Collaboration is minimized. D. Peer review is discouraged. 28. Which evaluation method ensures fairness in EEG competency testing? A. Standardized objective scoring rubrics. B. Subjective grading by one instructor. C. Informal observation only. D. Oral questioning without criteria. 29. In adult EEG training, motivation is best enhanced by ... A. Linking learning outcomes to professional goals. B. Assigning irrelevant tasks. C. Restricting learners' decision-making. D. Focusing on unrelated topics. 30. An EEG educator using reflective practice journals is encouraging A. Self-assessment and deeper learning. B. Superficial memorization. C. Avoidance of critical thinking. D. Unstructured discussions only. 31. The principle of regulatory compliance in EEG practice emphasizes A. Adherence to national and institutional policies. B. Ignoring state-level variations. C. Prioritizing speed over accuracy. D. Documenting only favorable results. 32. A curriculum evaluation that measures graduate performance in clinical EEG roles demonstrates A. Outcome-based assessment. B. Input-based review. C. Randomized learner survey. D. Attendance-based reporting. 33. Which mentoring behavior strengthens adult learning in EEG practice? A. Modeling best practices during procedures. B. Limiting demonstration opportunities. C. Avoiding learner engagement. D. Using inconsistent instructions. 34. In EEG education, formative feedback is most useful when A. Integrated throughout the learning process. B. Withheld until program completion. C. Provided only for high achievers. D. Restricted to written exams. 35. An EEG instructor ensuring cultural sensitivity in teaching materials demonstrates A. Respect for diverse adult learners. B. Focus solely on technical accuracy. C. Exclusion of contextual factors. D. Prioritizing uniformity over inclusivity. 36. Which teaching approach best enhances EEG trainees' ability to interpret abnormal patterns? A. Guided analysis of authentic clinical cases. B. Rote memorization of definitions. C. Exclusive reliance on lecture slides. D. Limiting exposure to varied case types. 37. In EEG competency assessment, which method best balances validity and reliability? A. Objective structured clinical examination, OSCE. B. Open-ended essay questions only. C. Instructor's personal grading style. D. Informal peer discussion. 38. When mentoring EEG students, reflective questioning is primarily used to A. Stimulate critical thinking about practice. B. Provide learners with all correct answers. C. Reduce learner autonomy. D. Focus only on technical repetition. 39. A core element of curriculum development for EEG continuing education programs is A. Needs assessment of current practitioners. B. Eliminating advanced content for simplicity. C. Using outdated regulatory frameworks. D. Ignoring learner diversity and goals.